with this live broadcast by telling the hilarious story that 5 minutes before I was going to come in here and set up, a smoke alarm started going off either in this room where I currently am or in the hallway just outside. And I had just realized that this was going to be live. I was thinking we were doing a recorded one. And so I cannot describe to you the level of inner panic that I experienced trying to rip the smoke detectors down from my house so that we could have a couth podcast today. But it happened. I'm not hearing any beeping. Fingers crossed and prayers lifted.
Yeah, what's the delay?
Congratulations.
Can Ryan be like on a mute button and just like hit it right before right after the chirp?
That he has incredible skills. I think that is totally plausible. That's totally plausible to do.
I believe it.
Is Patrick joining us or not?
Yeah, Patrick said he's going to be 10 minutes late. I don't know where Freeman is. They're probably, no internet where he's at in Montana.
There was a red X next to his name. I think he canceled.
Wait, really?
I didn't know you invited Ed and Patrick either. We got a bunch of like extra autistic savants in this one. This
That's that should be worked into the title, I think.
Autistic savants.
For the recording later. Yeah. Either that or Average Boys Night podcast.
I don't see any guns though. We need guns.
I was about to say, are we all gonna start reaching?
The fact that you had a gun like within reaching distance.
Yes. Yeah. Yes.
Mine's
yes.
holstered.
Absolutely.
Yours is cased.
Absolutely. Mine is cased. I was going to uncase it. Would y'all like me to uncase it?
Might as well.
This is one of my favorites. So this is an AR-15 that I assembled myself. It is the one that I took to the last run and gun competition.
What's that chambered in?
It's 224 Valkyrie. 224 Valkyrie, and it's mostly Palmetto State Armory parts. The barrel is Palmetto State, the lower is Palmetto State. The rest of it is just Frankenstein from other parts I had sitting around.
And in the event you're running with that scope?
Yes, yeah, absolutely. You just have an adjustable,
15-pound
quick
gun,
adjustable
whatever.
sling and battle belt and sidearm, and it's a biathlon event where you run about a mile, usually a little over a mile, and then you have a shooting stage, and it might be a pistol only stage, it might be a pistol and rifle, or it might be just a rifle stage. This one, so I built it in 224 Valkyrie because this was a sniper challenge, and I've never shot that far, but I hit targets at least 938 yards with this rifle in the rain, and it cost the scope is more expensive than everything else you see.
Oh, that's how it always is.
Quite a bit right there. So I was very proud. I also took
938 yards.
938 yards. Yep, that's my longest confirmed hit with any rifle ever.
Wow.
And I had never shot. Well,
I mean, while you're
yes,
like obviously your heart rate is up.
I'm recovering from from cardio while I'm getting adjusted and shooting, and it was raining. It poured rain all day long, so sometimes the rangefinder wasn't even working on that day. So anyway, yeah, came prepared.
New level of respect for Cogburn.
Heck yeah.
We met up at Chewy's. We met up at Chewy's like after the meal. He was like, "Come here, I got to show you something." And you showed me.
I got that one. That one's right over there.
Yeah, like nice. Would have been disappointing if that didn't happen.
Yep, I have a gun that I fitted. Jake has seen a picture of this one. I might run and get it while someone else is talking in a little bit, and I can show y'all. It's a 300 Blackout AR pistol, and my first COVID project, because we all needed stuff to do. We were stuck at home. We didn't know what was happening, and I had all the parts for this pistol, so I built this AR pistol, and then I had picked up a Pelican briefcase from a pawn shop for like $25. Very nice, Pelican's nice stuff. And I had already ordered the pluck and peel foam, and I was trying to figure out what am I going to do with this pluck and peel foam for this briefcase. Well, I started taking that rifle, taking it down, and taking all the accessories and stuff and laying them out, and I pluck and peeled it. So I have this entire pistol plus suppressor plus 2 mags will fit in this Pelican briefcase, and I take it with me when I travel anywhere more than like 2 hours away from town, so that I always have something with a little bit more oomph. I'm never without something really useful that could come in handy if some kind of weirdness happened.
Yeah, that's cool.
I confess I'm entirely just like a sports enthusiast. I like going to the range just for the range sake. I know that like joke about home defense and training and all that jazz. No, I just like going to the range. I feel good. I walk 2 inches taller for the rest of the day. It's just a hobby.
Absolutely.
Heck yeah.
I told.
That,
Oh,
go ahead.
I told these other guys about it. They ended up calling her Range Xena. But I asked this girl out to dinner, and she goes, I'm actually busy that night, but how about Thursday night you come to the range with me? And these are like, oh, yeah.
That's my idea. That's my idea of a great first date.
Yeah.
More people should do that. And it's funny because, there are tons of people that I've taken to the range who are like very anti-gun. Like maybe they grew up in the city or they were just vehemently against it. But almost every time I take someone to the range, they're going, when can we come back again? When can we do this again? Like it's just a fun hobby.
You got to remove the mystery a little bit.
Yeah.
Have you taken our course, the Walk the Talk America course, Ed?
I have not.
Do you even know what I'm talking about?
I do not. But why don't you tell me?
I have those over there too, Jake.
Yeah. So Walk the Talk America is a nonprofit that's bridging the gap between firearms ownership and mental health care. And like at our core, we're suicide prevention, but we're trying to find innovative ways to get gun owners access to counseling services without fear of rights restrictions. So we don't like policy interventions unless they're non-restrictive. Mm-hmm. And so we have a cultural competence course series. There's parts 1, 2, and 3. Parts 1 and 2 are available for free on the website. And if you take the quiz at the end, it'll spit you out a little certificate and it'll ask you, do you want to be listed in our, Pro 2A provider directory that we have on the website. So we'd love to have you in there if you want to take that.
Oh man, I'd happy to be involved.
Part 2 if you want.
No, this is a big passion of mine because I work with veterans. I was former Army myself.
Where have you been?
I lost more friends to suicide than small arms fire. And one of the things that I see a lot working with veterans is they don't want to talk about suicide because they are afraid we're going to take their guns, and we don't want them. We don't want your guns.
Yeah,
we want you to be safe. We can come up with some ideas, but we're not trying to take them. I don't
it's a whole thing. This emergence of the red flag laws across the country. There's now 22 states that have them. We believe that they're deleterious to care access, and we think that they provide barriers, not access and healing. So, unfortunately, we don't have any literature on that because nobody wants to study it. So, Walk the Talk America put out a survey in 2023 asking that question. We did it again in 2025, and our N for survey respondents in 2025 was like 2,400 people. And we admittedly it was a self-select opt-in that oversampled for old white guys, but we ended up with a 50% yes, I would avoid care if it meant my rights could be taken response rate. So it was it's substantial. If we're pushing away that many people from care, we're certainly not helping. We are probably, I would say, harming. And so that's a big thing. We just got back to your point about the range, though. We got back from Louisiana a couple of weeks ago where we did a couple of trainings with firearms instructors as well as mental health practitioners in 2 different locations. And it was held at ranges, and first time experience for some of them. Some of it had been quite a while, and everybody was like, man, that was great. We debriefed, we talked about what the process was. And there's a military social worker named Paul Santilli who's been trying to get a paper published on the therapeutic advantages of guns and how we should train our practitioners to introduce these concepts to gun owners. Say, hey, if shooting helps your anxiety, go shoot, right? And it's nothing better than coming back from the therapist's office saying, honey, I got to buy more ammo. Doc's orders. But it's a real thing. Like we need to explore that more. Hello, Patrick.
Hello,
Patrick
Jake.
Lockwood. Is that an iced coffee I saw?
Unfortunately.
So I was kind of excited for you coming on because I was hoping we'd get some Celsius belch going on, but that's not going to happen.
I mean, I can go downstairs and get one real quick if you really want.
Okay. So let me hop in really quick because I was holding this up a second ago. This is what Ryan was referring to there. This is my briefcase AR-15 pistol, and you can see I've got 2 mags in there. I've got a suppressor. The suppressor's right down here near my thumb, so hopefully that's visible to the audience. But this was a fun COVID project, and it shoots great. Gets dirty as all get out, though, man. I've got to clean it constantly.
It's never going to be clean. It's never clean.
No, not at all.
Yeah. I mean, in California, that's a dream out here. We could possibly never own anything like that out here, unfortunately.
Hey, you're working on getting that lever gun though. We've been talking about that lately.
All
I've
you
been
have to
sending
do is
him.
drive over to Nevada, and you can get a grenade launcher. You can get
Yes.
anything your heart desires.
You know, I have at least one friend in Nevada who might be willing to help me, so I'll have to talk offline to whomever that may be.
Yeah, you're only limited by what you can afford in that state.
Exactly.
Yep.
Exactly. Yeah.
Has anybody talked to Freeman?
He's
No.
got a session, right?
That's what I thought he said. I thought he said he couldn't make it because he had a patient.
Oh, I must have missed that. Sorry.
By
Maybe
the
it was
way, Ed,
was it in the
thank you
email?
for saying Nevada the proper way and not putting an H or a W in the middle of it.
Nevada?
Nevada.
Nevada.
So much of that.
Well, I
Oh
was
my
trained
God.
at, unfortunately, because I moved there saying Nevada, and they had to give me the nail on the chalkboard speech, and I was like, you mean
you
you
live
guys
here?
are pronouncing it incorrectly? That's you're not supposed to. If you can't change a vowel, if it has two vowels, you don't just change the sound of it. That's just not how English works.
How does
Try to-
English
try
work?
to
Can someone
convince a
explain it to
Nevadan.
me? Yeah.
What's that?
Did you live here though? You moved here? When were you here? What were you doing?
I moved there after my postdoc until the pandemic. I was working at the VA out in Reno. They sent
Shut
everybody.
up.
Yeah, they sent. We had one of the best responses to the pandemic, in my opinion. Like we got everybody squared away. We even handed out like iPads to elderly who just are technologically impaired. And then after about 3 months, the bean counters in Washington told us all to
I'm
dress
wondering
red
if we
dress.
cross paths.
Oh yeah, are you up there? Where are you stay or where are you working?
I'm in Reno. Yeah.
You're in Reno. Oh no way.
Yeah, I live in Sparks, and I worked really closely with the
Yeah,
VA for a
I
number
lived
of
in
years.
Sparks.
I was on the Mayors and Governors Challenge teams too during that time, like leading up to like 17, 18, 19.
Uh-huh.
That's great. We had
That's
to
wild.
overlap. That's wild.
Yeah, we might have bumped into each other and never knew it.
Hey, small world.
That's
Now you're in
amazing.
Ohio.
Yeah, home sweet home.
So y'all ready to kick this off officially?
Yeah,
I thought
sure.
we were
let's do
kicked
it.
off.
Well, I
it's-
mean, yeah, we've been chit chatting,
We just been having fun.
just having fun. So one of the things that I think is topical to the mental health world is there's like this therapy culture that says everyone needs therapy and therapy is a universal good. And on the other side of that is kind of Abigail Schreier's bad therapy, where most therapy, except for in extreme circumstances, is a bad thing. And you've got Matt Walsh saying all therapy is bad. How do you navigate that conversation around like is therapy good, bad, like as a therapist?
Let's all talk at once. Oh.
Great idea.
Ryan, you're the moderator. You pick somebody.
I'm
You
happy to
go ahead.
I'm happy to
Jake
break the ice.
Wiskerchen.
Go.
Yeah, everybody with
I-
a doctorate from him, sit down. This is MFT
Go to Dr.
time.
Perin then.
I tend to bristle at the word need. I don't think psychotherapy is a need. Air is a need. Food is a need. We look at Maslow's hierarchy. You don't see therapy wedged in somewhere between like friendship and self-esteem issues. I do think that anybody could benefit from therapy so long as what they want to collaborate on can be addressed in therapy. I don't necessarily think that therapy has to be corrective. I look at it as a developmental process, and we're always going to be developing. And I guess the lame broad answer that I would give is it really depends on what kind of therapy the person is looking for.
Let me offer something because this is a really good point to jump off for debate. Stephanie Wynn and I had a conversation about this, and she brought something to my mind that I've changed my mind around because I used to think that too. And I don't think that everybody needs a therapist. I think the pendulum swung from nobody talks about mental illness to everybody needs a therapist, and we've kind of gone too far, except for certain demographics like tough guy professions, plumbers, pipe fitters, law enforcement, firefighters, airline pilots. There are still pockets where the stigma is very real, and it's not necessarily about getting help. It's about what does everybody perceive you to be when you ask for that help. So I want to put that asterisk on there and set that aside. But What Stephanie brought to my attention is the idea of therapy being medically necessary and consultation as a different concept, which is more of what you just described. And I really like that because it communicates to I guess, to the consumer base, the audience to which we'd be offering these services, that therapy, that word, can stay nested within the medical model, be time limited, targeted to heal illness. And I like that because it aligns with physical therapy as well, and speech therapy and occupational therapy and all the other therapies that we know. And if you go beyond that, beyond basic healing, back to normal stasis, and you want to enhance, then you'd hire somebody like a personal trainer if it's physical to get better at your thing, or a coach if you're in a sport. And I think we could probably serve in that role as well for lifelong accelerated enhancement of one's own inner discovery, exploration, self actualization. And I think that that probably has a very legitimate purpose in society. But I think we need to delineate those for the broader audience because there's a lot of confusion. So we end up with, everybody needs a therapist, because even though I'm healed from my illness, I still want to keep pursuing this because there's more depth, and human psyches have endless depth to them. So I think if we can demarcate that, we can also appease the managed care insurances who are usually paying for the illness correction, and honor the person's personal path to perpetual growth, and still be of an aid of some sort without creating dependence.
I want
I
to
would
just tack
go.
on there. Oh,
Oh,
can I just tack on real
no,
quick, Patrick? And then
feel free.
absolutely,
Yeah, yeah,
I'm just going to tack on
yeah.
there. Jake's perspective there is fairly heretical, at least somewhat heretical for an LMFT, but I
Yeah.
don't disagree with much of it. I think there's some good wisdom there. And Stephanie herself is an LMFT, if I remember correctly.
Yeah.
There's room for flexibility in those definitions. So Patrick, please.
Yeah, for me, I kind of struggle with this conversation because first and foremost, I would like to never listen to anyone who doesn't have one of our degrees. Ever. Full stop. I don't give a shit what Matt Walsh thinks or anyone thinks. And I rarely give a shit what I think, to be quite honest. So,
True non-attachment, by the way.
yeah, Buddhism has really done me a lot of good. You know what I mean? So what I would say is there's three types of services that people with our kinds of degrees can do. We can do consultation, we can do psychotherapy, and then we can do coaching. And so I think there are a great many licensed clinicians, unfortunately, who do a lot of life coaching. And that's their deal, you know. I would never call it therapy. They have a paid best friend. And that's not what my ethics code, I believe, says I should be doing. But I could be, not that I like the APA, just so we're clear, but that's technically not what I'm supposed to be doing. Now, certainly I can consult with people. I can do executive consultation like I do. I can work for businesses. I can whatever. I can do all sorts of things with my knowledge and training and stuff. But then I think, kind of like Jake said, I would differentiate therapy because not only for the logistical medical model reasons that you described, but also for the practical realities, right? So I want to emphasize the idea that what Dr. Perin is saying about this developmental approach to clinical work, I think is valid. I don't think it's invalid or anything. However, the question that I would want to ask if I were in your shoes is what I'm trying to do managing an illness, or is what I'm trying to do help someone grow? And I don't think those are the same thing, right? I think that those are actually drastically different things. And so from a very practical perspective, regardless of who's paying or what the context is or what the setting is, managing an illness and helping someone grow aren't the same process in any way, shape, or form. And so I think the people who call helping people grow therapy, I don't think that's therapy. I don't. I understand why people call it therapy because they're trained in graduate psychology programs or they're in psychoanalytic programs or whatever it is, but like, I think growth is an accident in therapy, whereas in coaching or consultation, growth is a goal, is kind of the way I might say it.
I would actually say that the two concepts you just laid out there are mutually exclusive. I don't think you can grow while you're ill. I think the
I don't
primary
agree.
function is to return to base and then grow. I think you'd probably risk harm if you're trying to grow somebody. And I work with some pretty impacted people, and have over my career, and it is really tempting to avoid the acute pain that's causing the illness because it's hard. But also we see potential in people, and we want to just fan those flames because it's more fun. You're like, yeah, you should promote at work, and it's like, yeah, but I'm heavily depressed. It's like that's contraindicated in my estimation. I really appreciate how you delineated that.
I just think
I
that growth is unavoidable if you're doing good psychotherapy for a medical problem. I think it's just a natural consequence of doing good
Yeah.
psychotherapy.
yeah,
Whatever
so
the modality.
I was going to jump in there and say I suspect Ed's going to maybe say something about post-traumatic growth. That's where my head went when you said I don't agree, right?
Well, I was also thinking kind of post-traumatic growth because, I guess I could use the DSM as a model for what we would call an illness or a disease, but
Yeah.
very few people come to my consultation room saying, I have this illness, I have a depression disease, and I would like to heal from my depression disease. They're hard. It's hard to articulate. They don't come with this single time limited problem. They often say, I'm in pain and I want more than this. I want to be beyond that. So
Yeah.
even if they are coming for what might presumably be a medical issue, really what they're asking for, I think, is that development, that growth, and someone to walk with them, not, correct them, but walk with them during that growth process.
I I actually agree. I think I agree with what Patrick and Jake are saying in one sense, that that growth is in some cases at least a byproduct
Hmm.
of the healing process, the the maybe developmental trauma. Let's say that somebody's been through inhibit their development, and so when you resolve developmental trauma, it opens a gateway for
Hmm.
inhibited development to then pick up and occur more normally. And
That's actually a
post-traumatic
big part
growth,
of my dissertation, how it stops that developmental process.
oh,
We get in a
nice.
maladaptive coping pattern, kind of like a roundabout.
So 52% of people who endure traumatic disturbance report post-traumatic growth, and in many cases, the emergence of post-traumatic growth, meaning strengths that the individual possesses that they did not possess prior to the trauma disturbance, um, that that those begin to develop before remission of trauma, before full trauma recovery, and in part they're an adaptation that is functional in helping the individual achieve trauma recovery, and they retain those new strengths following trauma recovery because of the adaptive nature of those strengths. So there's a little bit of overlap, I think, in what y'all are discussing and gently debating there.
Yeah, that tracks.
Well, I think really what we're debating is what to call it. Because,
Yeah.
yeah, sure, if somebody's coming in with maybe like an organic, maybe like a bipolar disorder, and, we come up with like the perfect protocol, we connect them with medication or et cetera, that's fine. But like, that's not a big part of my caseload. Another of the bigger part of my caseload, I think, is okay, now that I've got through this, now what? Okay, now that I've gotten through this, now what? And so on and so forth. I don't necessarily think I change my approach in different situations. They just have different needs. Do we need a different word for them? I would even throw a wrench into a third category, which, that you probably have all seen it, where a patient goes to like some weekend workshop where it's like an embodied thing where they maybe keen or shout or cry, and it is transformative. Like they come back and they say, I got more out of that weekend workshop than I've gotten out of like a year of therapy and what more. That's still technically therapy, even though they're not coming back to it.
This
I don't know
Isn't
if
this
I'm making any sense or if I'm just
yeah
muddying the
this
water with these.
this presents a very interesting question. I had Mark L. Ruffalo. I think y'all know him.
Yeah.
Uh-huh.
Had him on, and one of the last questions I asked is, "What is therapy?" Like, I'm about to finish a master's degree, and I'm not sure I could accurately answer that question because you get so many different answers. Like, is it about insight? Is it about change? So I would present that question, y'all. What is therapy?
Uh, I'll go back to my definition, and it works for me, and it works for the agency, and I'm raising students and interns in this, uh, I guess you could say, this setting as well. So for our purposes, I default to intentionality. It's a Christian Conti. I learned it from him. It's not his term, but I learned it from him, and I embrace it in most of my life. If you know why you're doing what you're doing, it puts you in charge of your decisions and your responses, so that you're not reflexively, emotionally, or unconsciously responding to stimuli. So intentionality matters. And if somebody walks in here, I would say we're doing therapy, and therapy is defined as you're sick, we're going to make you well. That's my definition of therapy. We could certainly apply everything that everybody said to that word. So in my little piece of the world over here, I want to make sure that we're intentionally doing something to a targeted goal, so that all parties involved know when it's done, and we can choose to end, because discharge should be the goal in my estimation, especially with my realm and managed care, and we're managing sicknesses and illnesses. So I want a terminus to this. I want an off ramp. So that's my definition of therapy right now. However, I'm not opposed to calling lots of other things therapeutic. Shooting at the range can be therapeutic, and it can be a therapy. I can go take one of my friends' teenage kids who's struggling with what he wants to do after he graduates high school, and have a burger with him, and that's therapeutic. And still, there are many people in our field whose heads would roll off their shoulders if they knew that I was doing that, because they'd call it therapy, and then therefore it would be treatment without consent, and then I'd be hauled in front of my licensing board to account for such things. So the delineating factor there, I would say, is, did you raise your hand and clear your throat, sign on the dotted line, affirming consent to the following processes of therapy, with a stated goal and treatment plan, with marked progression through that process? That's what I would call therapy in my domain. It works for me, but I'm not going to die on the hill for anybody else. I mean, of course there's therapies.
Hey, so I can jump in there a little bit, because I can throw the education variable in there. I've been having to write a lot lately. Oh, and can I shamelessly plug anything? Is
Yeah,
that
Always.
allowable?
go for it.
Great. Yeah.
So I decided recently, and Jake and Ryan know this, I decided to launch a Substack, and I know there's too many Substacks out there to read. Um, but I'm doing lots of natural writing about the overlap between mental health and education because of my job. I work for an agency that provides required trainings to school districts on things like trauma-informed care, behavioral threat assessment. There's lots of controversy over mental health, um, like interventions encroaching too much into education, and there's pushback in Texas where I work about this,
Hmm.
and legislation has just been passed, and everybody's freaking out in schools because they're like, what can I do and not do? So the quick plug is Systemically Texan is the name of the Substack, and it's a play on my Twitter handle, my X handle. But just as a quick one of the first articles, I'm actually going to publish an article tonight. I'm launching it tonight. I decided I have one article that is just almost ready to go, and I plan to drop another one by Monday on what I'm about to tell y'all. But so when I talk to school counselors, for instance, the way that I describe what they should be doing is in the terms Jake just mentioned. We should be acting in a therapeutic manner with students from the position of a school counselor. But the purpose of that is to, in the short term, alleviate distress that is impairing the student's ability to function at school. That's what I believe to be a healthy limit for intervention for mental health support in schools, and it absolutely needs to be there. I was sitting in a district today and dealing with helping two school counselors deal with a situation where a student's experiencing moderate to severe suicidal ideation and has a parent who is not an emotionally reliable caregiver, and the school counselor is the only person in this student's life who's motivated and capable to get that student set up with some kind of help and support. Like we're not going to get away from mental health support existing in schools. That will never happen at this point. But we can certainly restrain it to a healthy degree. And so that ties to a definition that I would use for therapy. It's maybe not perfect, but it's kind of plain, and it sits right up against what I just said should be occurring in education, which is therapy is the attempt in working with a client to help them long term resolve underlying issues that are producing a problem or disorder, and I'm shooting for something like marked reduction in symptom intensity and frequency, or total remission, and again, long-term or permanent. And I think that's an excellent dividing line where the school can be therapeutic and create an environment that is supplementally supportive to something like a trauma recovery process, but that does not encroach too much or put the school district into a dual role relationship where they are now a trauma recovery entity and an academic development improvement entity. And dual roles don't work much better for large organizations than they do for individuals. So something like that line needs to be there.
You mind if I jump in? Because I kind of want to play with your definition. My definition was handed to me by a supervisor. He says just replace the word therapy with the word change. People go to change, they see a changeist, they sit down for change, they do an hour of change, and the real change happens in the week between sessions. That's the definition I mostly stick by. But I used to work with schools, and the difficulty with that is who change who for what, like who wants the change
And for how long?
You know, and but you know who benefits from it. The teacher is responsible for an entire classroom. The administration is often responsible for the parents. The parents are the customers. The parent cares about their one child, right? And so, you know, a therapist or mental health person comes in, they have to navigate all of these like different motivating factors. Very few people are actually asking the kid what they want to change. And it's not always I want to get better grades and I want to, you know, have better relationships in my extracurricular activity so I can go to college. No, it's often something very difficult to articulate. So I actually am very cautious when the schools come up with the change agenda. I think in Ohio we call it character education, where they say we are going to teach morality to the children, and that's where a lot of the friction is coming here. Is that he's like we don't want you to teach the morality. Let them come to you if they're having problems with academics or interpersonal relationships or depression, but don't you change them to your agenda, I think is the hot point.
I would echo that's the concern among parents and legislators here in Texas also. Very similar.
Dr. Lockwood, what you got?
He's squirming. He's
He's
squirming.
squirming.
Yeah.
Should I
because
say it? Should I
there's-
not say it?
Yeah, it's not that question. I don't
Oh,
care,
okay.
obviously. The problem that I face with this particular question is not to do my best Jordan Peterson impression, but like, what do you?
What
Like,
does mean?
Yes, it's that kind of thing. I'm caught on the idea of, is that actually the best question at what you're trying to get at? Because you're trying to get at something very
You want me to shift
important.
hosting powers over to you?
No, God, no. This is your ship. I'm just here to look good, you know.
Got
So
him.
for me, it's just a question of, do you actually give a shit what the definition is, or do you give a shit what's effective? And I think you really care more about that than you care what the definition is. I think that's intellectual masturbation, which I don't think that's why we're here.
That's a very good point. I appreciate you bringing that up because that actually is not my key question. And I think I work with a similar population as you with
Yeah.
addiction. And there's a lot of times where I feel like what's effective in what I do would be categorized as coaching.
Yeah.
And sitting
agree.
back and saying, how does that make you feel? Seems like complete BS. That people whose lives are on the line are not getting better. And when Dr. Perin, when you described therapy as change, that seems so powerful to me, especially with the group of people that I work with. Does that make sense, Dr.
Well,
Lockwood?
Yeah.
Can I piggyback on this though? Because I am trained psychodynamically. I have had I am in psychoanalysis. My own analyst does not practice psychotherapy the way I practice psychotherapy. In the very rigid, purist psychoanalytic approach, there's zero coaching. Like that is not even on the just not even in the periphery here.
Nope.
But what they tend to miss is that there are sometimes people just genuinely don't know. Like, oh, sunlight actually spending 20 minutes outside in sunlight and getting vitamin D boosts my mood. I didn't know that. I'm going to go out and do that. The role of psychoeducation, which is mostly what I do on Twitter and X, is to just share the information. It's not therapy. I'm not actually trying to make the unconscious conscious, but some people just genuinely don't know. And, if you're practiced to not give any advice or give any behaviorist intervention or anything whatsoever, you might be missing the Occam's razor that they just, specifically, like step A, step B, step C. What if they have a dog and they're just struggling training with their dog, and you can just teach them very basic, like, operant conditioning so that their dog is a little bit less of a menace. You don't have to ask them, how does that make you feel? You tell them, oh, this is how you can train your dog.
Yeah, just to continue that thread, I think that's why I don't care about the definition, because I think that the reason all 5 of us are in the room or whatever is because we don't care really about the definition. We care about people actually getting better. And so personally, you could pick any definition. You can go with Jonathan Shedler's definition. You can go with the APA's definition. You can go with Jake's definition. I don't really care what the definition is. The question is, what job was I hired to do? Right? So in Rehabistan, like you're talking about, I'm
Worst
there to
amusement
help
park
people.
ever.
World's worst amusement park. I think Therapy Land is, in my opinion, the world's worst amusement park. I think that only a true sadist or a true masochist likes Therapy Land, which brings into question why we're all here. But my genuine
Nobody
belief
said we
is,
like it.
yeah, well, that's a different story.
It's a
But
calling.
I love it, but
gross.
I have a masochistic flair, so
There you
Yeah, I
Confession
believe
Know
it.
time.
thyself.
Yeah, so for me, it's like what actually works, right? And so if coaching works, do coaching. If consultation works, do consultation. If therapy works, do therapy. Like literally, the literature is abundantly clear. Psychoeducation is one of the most powerful interventions for people with schizophrenia, bipolar, major depressive disorder. It's not even a question. So
but the billing
psychoeducation,
codes, how do
yeah.
we submit that for insurance reimbursement?
Right, but it's part of
Oh
CBT,
no.
it's part of DBT, it's part of ACT, it's part of all those things. But like psychoeducation clearly works. We have decades of research that confirms that. So the question is just, what do I actually need to do to like work with this person for their goal? Is the question we're here to answer. Like I don't care about like I think the moment we get caught in the definition thing, we're stuck on Twitter and we're defending ourselves against Matt Walsh, and I don't give a shit about anyone's opinion. I
Hey,
don't.
it was my idea to inject Matt Walsh into this particular podcast, so y'all are welcome for that.
But you know what I mean, though. It's like I don't really care what people think outside of the profession.
Well,
I
to
don't.
be fair, most people kind of know what psychotherapy is. They maybe don't have a lot of practice putting it into words
Yeah.
like we do.
Yeah.
We've had to practice putting it into words since our grad school applications.
Mm-hmm.
But most people have been exposed to it in movies, television, books. They know what a therapist is. They might not
Yeah.
know the technique or the or whatnot, but they know what to look for,
Yeah.
how to sit down, how to approximately spend an hour, and hopefully their mental problems are going to go away. I don't think we have to get into too much nitty gritty. I think what's more important is informed consent. We tell them what the process looks like, what kind of questions we're going to be asking, what actually sitting in the chair is going to be like for an hour for them. That's more important
This is
to
why
me than a
this is
definition.
why intentionality
Couldn't
matters
agree
to me.
more.
And
Yeah.
I think because so many people are not in the profession, we have to be cautious with what words we use, and we can use those terms interchangeably in the course of a session. Quite honestly, I mean the discrimination model of supervision from Bernard and Goodyear asks you to change hats as you go through it. Are you a coach? Are you a counselor? Are you a supervisor? Are you a mentor? And it's completely appropriate for us to do that. I think there's an advertising and marketing component here that we have to educate the broader populace on what it is they're signing up for. And I think it bears merit. But to Patrick's point, I don't care either. And it's hard to take fledgling clinicians and stay within their rigid, sometimes overly rigid graduate education, deprogram them from all that, and help them see a broader view of what it is that we do, and say, let go of all that you thought you knew, embrace the holistic nature of what it is we're trying to accomplish, which is help and healing. And what does that look like? Well, it's highly individualized. So of course we're going to fight over the terms because everybody's going to call it something different based on what it means to them. And I think that's really true. The root of cultural sensitivity is treat every individual individually. Don't do the blanket terms. Don't do the DEI crap where you're generalizing based on some anecdote from a population. You turn this person into an avatar, and all of a sudden you're talking past them instead of speaking with them. So, yeah, I don't know. We could beat this horse probably.
Oh,
into the
you're making me
ground.
think of diagnostics, just diagnoses in general,
Yeah.
how people will glob onto those in the same fashion, but we treat people, we don't treat diagnoses.
So
Yeah.
Yeah, and I say that regularly. I said I don't want to treat symptoms. I want to treat problems because problems give rise to symptoms. And I happen to think that everything in this book is a symptom, and that's also unorthodox and somewhat heretical. That's not a problem. That's not a problem book. It's a symptom book.
Yeah. My experience as a
I walk in
supervisor is
circles
you
that
could,
throw the DSM in the trash. PDM,
Yeah.
PDM2, PDM3 is coming out in a month or two.
it's almost there, yeah.
Yeah.
I think my experience as a supervisor of new clinicians is you give them 6 months of actually dealing with people in a high pressure circumstance and they start to not care about their graduate education anymore. That's why I like Rehabistan, because there's a practical reality that you can't avoid when someone's acutely very, very ill with a substance use disorder or depression symptoms or whatever it is. And so, the thing about private practice is you can just hide. You can hide, you never have to deal with the system, you never have to deal with whatever it is. And so it takes twice as long or 3 times as long to actually deal with practical problems in many situations. But like my interns, not that I'm bragging about myself, it's just that because we live in this pressure cooker together and we have to solve clinical problems very quickly and do something that actually works very quickly, whatever the modality, whatever the thought process, you don't have to adhere to your rigid grad school bullshit, because there's all sorts of pressure that's extrinsic that you can't do anything about. They're going to leave treatment in 90 days or 120 days. And what are we achieving in 120 days? Because they're either going to go back out there and get high, or we're doing something that works right now to help them create a better structure for themselves, better relationships, so on and so forth.
What do we
So,
want? Sustained remission. When do we want it? Now.
Yeah, exactly.
So if I
Yeah.
can jump in, I love these answers. I think they're very useful answers, and like one of the themes I'm picking up on is kind of this idea of like Matt Walsh is not one of us. He doesn't have like a license, so he doesn't like have a right to comment on our profession, like some type of that mentality. But therapy has entered the public sphere. It is a social, cultural, political issue. We got therapy culture that's like kind of part of the public milieu in a sense. How do you think our profession like handles that spotlight, like therapy culture in the public sphere?
Our profession's
Terribly.
terrible.
Terribly.
Yes, awful. I'll just say awful.
Generation gaps too, I think.
Oh, yeah.
You're getting the younger ones who are really tech savvy, running these very complicated podcasts. And then you get the
Thank you
older
for calling me
ones.
He's
younger.
not that young.
You need a few
on,
gray
Jake.
hairs.
we
You
got
need a
we
few
got
more
like
gray hairs.
75 years of experience on this
Sweet
screen.
talker. Sweet talker.
Thank you for calling me young.
You do. You're extremely youthful.
I appreciate that.
You're the most youthful. It's the jacket, you know?
Yes.
Absolutely.
Two guys in jackets, 2 guys in collars, and 1 guy in a
But
t-shirt.
to the point, there are the people who actually I think have a lot of the weight and who I think would kill it on social media are not the therapists who know how to navigate and use social media.
Agree.
I don't know. I don't know about that. I think we just don't care. Like we're really busy. I know that
Yeah.
my marketing guy's great. I could kill it on social media. He's been leaning on me forever to become like the range therapist or the lead therapist and take on a moniker and go into the firearms community and do this big fancy thing. And I'm like, I'm not feeling that. Like, yeah, I could crush it, but that feels more ego driven to me than it is like solution oriented. So I don't know that I agree with that. I think there's a lot of really bright people out there who could potentially bring that to bear. And some of them we know they have really good presences. I think that the reason it's not effective is, first of all, it's really hard to make it sexy because it's overly technical, and we've made it overly technical as this book for the listening audience who's not seeing the video. I'm holding up the DSM every time I say that. And it's like, it weighs like 11.5 pounds now. It keeps getting bigger. It keeps getting more convoluted. Terms contradict each other. as Mark L. Ruffalo talks about, a crisis of comorbidity, where things really don't need to be multiply diagnosed because they all overlap. I mean, like that's the problem. And so you get really bright people out there sending really good messages, unless they're punchy and reductionistic, they just don't stick. So what are we left with? TikTok therapists who do the punchy reductionistic stuff, and they're often wrong. And that's what sticks. And so we have a credibility problem, not necessarily because we all suck, although I could make an argument that probably 80% of therapists aren't very good, but because we fail to communicate adequately what the point of this whole thing is. And oh, by the way, we've over pathologized normal human life.
Yeah, I mean,
My whole strategy is to use memes, and once they follow me with the memes, then I actually provide useful psychoeducational content. Haha, suckers! Now you're learning.
Top tier memes, I would say. Top tier
Gotcha.
memes, sir.
Yeah,
yeah,
top
very
notch.
good memes.
For
Very
I
good.
appreciate that.
Yeah. I think I agree with a lot of what Jake said. I think the DSM, by the way, would be a great range target for what it's worth. So if you ever want
It can absorb a 30-06 from 100 yards.
I believe it. So,
Not saying how you know.
yeah, just for what it's worth. I would also argue that there are really excellent communicators who just will never be popular because not only are they not sensationalist enough or whatever, I also believe that telling the truth is not very sexy in general. I don't think
Right.
most people want the truth. So you have to, I mean,
Well,
not
hope
to
doesn't
blame the
sell either.
consumers.
Nuance on social media. Are you kidding me?
It's not, but it's just not, people don't want the truth, in my opinion. I believe what most people want is they want something that conforms to a preconceived notion about what mental health is or what allows them to feel good about themselves. And so I really don't think it matters that the sane, reasonable people are never going to get the recognition they need because the people that actually need help will eventually find something. Whether or not there's a great post by the American Psychiatric Association or the American Psychological Association or Jordan Peterson or whatever, I don't really care that the vast majority of people are not going to get the correct message because if they actually do need help, eventually they will get help in most cases. Not all cases, but I think, like you said, there's reason to have hope.
Yeah, isn't that what society's supposed to do, is pick each other up? I mean, I regularly say that I'm trying to work myself out of a job, and I legitimately believe that. That's why I give all my shit away for free. I do, multiple podcasts, a YouTube channel, I write articles. Like, stay out of my office. Stop coming through my damn door. Like, if this place goes out of business tomorrow and I still have years left on my lease, I'll turn it into a brew pub and coffee shop because everybody's healthy and happy. So I do believe that, but also at the same time, what Christian Conti regularly says, and I've known for 15 years since I met him, 17, 18 years, is people don't want your advice; they want your approval.
I don't even think it's that. I think people want a relationship because they're starved for a relationship that works for them.
That's fair
Ooh.
too.
Yeah.
Well, I think there's two different things going on here. I think it's worth fleshing it out. Like, do people want a real relationship which requires vulnerability and you putting yourself exposed on the line, or do you want some type of shallow sham relationship where you're just affirmed and validated?
I think both. I really do think they want both, and I think it's very hard to discern which is which when you're that individual because they don't. Let me pull the lens back a little bit. For a couple of generations now, and we're all among the same age, we were really the original participant trophy generation, where it was like, here's an award just for showing up. So we're rewarding effort, not results. And that I think has had a deleterious effect generationally. Now we're raising our kids, and some of us have grandkids who are in our late 40s, early 50s. And what we've taught them to do is avoid vulnerability because we'll just give you the successful award based not on merit or results, but merely on arrival. And I think that's really confusing when they haven't, the children, I'll throw us into that category too. Well, by and large, and it's gotten worse because of what I just described, by and large, the children have not seen for them, seen modeled for them sacrifice and effort amounting to risk, amounting to pain that then begets good sustainable results on the back end. And I think that speaks directly to what we do in the office here, where we say, hey, I'm going to push you and I'm going to take you into disequilibrium, because that's where change happens and that's where growth happens. And it's going to be painful and it's going to be uncomfortable. But all of society said, avoid that at all costs. And so we wrap everybody in bubble wrap and we wonder why they don't change. So what do they want out of a relationship? They want a relationship that's going to bubble wrap them. And deep down, I think they're very much longing for that. So I think it's a both and. I think they want very much to have a deep, meaningful connection, but they're terrified because they don't know that they can endure the risk that comes along with it. And that's why I teach emotional functioning. It's a wave. If you can get through the wave and get down the other side and realize you felt something and the world didn't spin off its axis, your brain literally can prepare itself for the next thing, even if it's bigger in amplitude. But if all we've done is teach avoidance, then we can't get to vulnerability. And out of vulnerability, we get intimacy. And if you don't have vulnerability, you don't have intimacy, you don't have relationship. So I think it's a both and people just don't know. They really just don't know because they haven't experienced it, they haven't seen it.
Yeah. So I want to piggyback on that. I'm like leaning in. I'm like I'm like dying to say what I want to say. So I'm going to say one of my catchphrases that I said to Ryan. I think the first time I worded it that way is when you and I were having dinner at Chewy's in Austin. What is this trophy giving phenomenon really, when we get down to it, underlying? It's a pursuer distancer pattern. Pursuer distancer pattern is at work, everywhere, all the time. That's my catchphrase. Every therapist should familiarize themselves with that phrase, whether you're a systemic therapist or not, I think, because we should be able to recognize it. It's a pattern of imbalance in a relationship where someone is taking too much responsibility for something, and in doing so, they unintentionally remove locus of control and locus of motivation from the person who actually needs to be responsible for doing the thing, whatever it is. And so I just want to highlight that pursuer distancer all the time, man, everywhere.
So let's apply that to distress tolerance. If you can't tolerate your own distress, how can you possibly watch somebody else in distress, like, say, your children? Mm-hmm. You ought to jump in and fix it. So you're overextending your own influence into their life as the pursuer, while what you're teaching them to do is distance, because you're picking up all the slack, you're doing all the work, you're helping them avoid all the accountability and pain.
And they will continue to function less, and you will have to consequently function more and continue to function more on their behalf, to a point where they become dysfunctional.
And we're wiped out. We're exhausted.
Yep, and that's where burnout comes from.
I think the parents are getting the secondary gain from that. I don't think we were the participant trophy generation. I think the parents were the participant trophy generation.
Good call.
They wanted to give it to us so that we could have those responses.
Very good point. Absolutely.
Sorry, I played
sports
and I got my fair share amount of those BS participant trophies. I never wanted them. I wanted to win. I was competitive.
I feel like in my generation, I think I'm probably similar age as you. It's like you definitely did not want, because they gave you bigger trophies if you actually won something.
Yeah,
so that's like
they put the freaking numbers on it. They said participation, not first.
You knew it was like a loser's trophy.
And it wasn't just sports. Everybody thinks, oh, sports. Yeah, okay. 1986 T-ball, and it's got me holding a little golden bat with this stupid little plastic thing with a wooden base. But science fair. My science fairs were blue ribbon for first, red ribbon for second, yellow ribbon for third, and maroon for everybody who entered an exhibit. Everybody got one.
Nobody wants to be maroon.
I think I got a gold one time. No, well, we all had maroon. Everybody got it.
Can I play devil's advocate for participation trophies?
Please.
So, something I've learned in adulthood is a significant part of adulting is just showing up. And so if you showed up for the science fair, that's like a big part of the science fair. A lot of people, smoking pot under the bleachers or whatever. If you showed up to work, like that's a lot of the percentage of what going to work is. Does that make sense?
Yeah.
Yeah, but you also have to perform.
So none of you are behaviorists, obviously. So the reward has to be proportional to the behavior, right? And so the issue is that these participation trophies, although I like your idea, Ryan, because
I've got the big book of act metaphors behind me on the shelf. Don't call me.
Yeah, I'll break out some Skinner. Don't tell me I'm not a behaviorist.
Anything I could do to cajole you guys into talking. So my main goal is just to say that I think Ryan's idea and spirit is actually completely correct in every way, shape, and form, which is that kids, especially, but all human beings. I posted about this today on X. I was like, Twitter, not X. Fuck that shit. It's Twitter. And so,
Did you just dead name it?
yeah, 100%. Come for me, Elon Musk.
We're bringing
Anyways,
it back.
I would say that there is an absolute lack of encouragement in the world. And so I believe encouragement is there's no, to me, there's zero ceiling on encouragement. I think encouragement is the most useful medicine on the planet interpersonally. Now, should it be a trophy? Should it be the trophy form of encouragement? No, that's fucking useless for most people because
That's
most
static
people
and
like
meaningless. It's impersonal.
exactly. Thank you. So I think Ryan is correct. He's just doing it the wrong way. And that's okay. He's not licensed yet, so it's fine.
I'm
Well
not
said,
licensed.
Ryan.
Yeah.
Well said,
Hey,
Patrick.
he's still in
Hey,
school.
give-
He's still
Well,
learning.
for
Yeah.
the immediacy, you give them the token once they show up, then play the game,
Yeah.
and the winners get the trophy, the actual trophy.
Yeah.
You're doing ADHD therapy now.
So
What?
I wanna talk.
I smell it.
We do have 4 male therapists and 1 male therapist in training here, and I want to talk about how therapy is often very coded as feminine. It's kind of understood to be a feminized practice of talking about your feelings and things like that. And this came up to me when Dr. Perin was saying therapy is change. To me, that's a very masculine way of understanding therapy. There's a purpose. There's a outcome that you're shooting for. And if Dr. Perin, if you could put on earmuffs real quick, when I'm talking to my guys in the center and I'm teaching them CBT and DBT, I'm describing it as a shield and a sword that you're taking with you through life into battle. How do we market therapy in more masculine terms so it's not thought of as something like feminine that boys and men don't do? Does that make sense?
Yeah, what's funny is I'm very proud of being here right now, and I'm not joking. I'm honored to be with you guys. And I screen capped this and texted it to my wife, and Heather wrote back, very eclectic group, and I said, bunch of middle-aged white guys. But we're here for men's mental health, right? So I think that a big part of this, and I'm just going to say this and dip out, I think teaching, first of all, is good because it hits the frontal lobe. Teaching neuroscience and the neuroscience of therapy is good because it's curiosity. Men like to figure things out. And so if we can offer something that's clever and creative and has practical, tangible application, like this is what your brain is doing in response to environment, it softens the blow and makes it more inviting. And then we can get into the woo later, like deep psychodynamic stuff and your conscious and your unconscious and your collective unconscious and your introjected beliefs. But it has to start with something concrete because men are concrete. I mean, we love the abstract, we love dreaming, all that stuff, but we also love to wrap our hands around something. What do you think?
Yeah, but there's nothing more concrete than so and so reminds you of your mother. You know what I mean? Like that's not super deep. or woo.
Totally.
You know, it's like transference and countertransference discussions. If you can't talk about those things in concrete ways, you're just stupid or you're uninsightful. One of the two things.
Yeah.
They're not that complicated. And my interns love it when we talk about transference and countertransference because it's practical. It's a practical, logistical thing. Is there a difficulty in the relationship because of how they see you or how you see them or both? Simple, practical. Also, I can't imagine needing to market this to men. Maybe that's a little controversial. I don't think there's anything to market.
I think it's because it's been culturally taken over. That's why it needs to be marketed.
I don't agree with that framing. I think there's nothing to market. Let good people go out there and do good work. They will be found. Competence always rises to the highest possible level. Also, let's keep having public discussions, but I don't think this is marketing. I think this is just five guys talking.
I mean, I agree with you. Look, the libertarian in me agrees with you that the market will figure that out, but it takes time. And I think what's happened is the overwhelming representation of therapy is feminine. and you have to have something other than the marketplace, which is dominated by 85% female therapists, to counter that. We have to make a presence. I mean, how? Like, it's been going on. If it were working, more men would go to therapy. They don't. So I think we have to market it. Now, it doesn't have to be billboards in the traditional sense, or social media ads. It could be this, right? Podcasts, Walk the Talk America, Guns and Mental Health podcast. Guns and mental health, those things go together. Yes, they do.
Half of
Right?
the tweets any of us drop on X.
Yeah, basically. I just think being good examples is the best thing we can do. I don't give a shit about
Oh yeah.
marketing or even trying to like help more men. I don't care about that. I think that maybe this is me being Christian or Buddhist or whatever. You can accuse me of whatever, but like if I'm doing the right thing, life will get better. And that's all I'm concerned about.
Patrick, Dr. Lockwood, I think we work in a similar field, and I'm sure you work with somebody who has just come out of prison and said something along the lines of, I ain't doing no therapy because therapy is for insert feminine slur here.
Sure.
You know what I mean? Like, you have to overcome that obstacle.
No, I don't.
Okay.
Nope.
No, because they're
refuse.
mandated.
Well, I'm kind of coming from a little bit between here because a strong majority of my caseload are male, and a lot of male patients and male clients search me out because I'm male. Kind of that point, we are 24% of the representation in this field. I was hired at 2 VA hospitals because veterans wrote their senators that there were no male clinicians in their mental health clinics.
Sure.
So like there are men who are explicitly saying, I want to work with a man. And it's because there are some issues that disproportionately impact men, or there are some issues that they don't want to have to go into some additional detail, and they want to feel understood by someone who has similar experiences.
Sure.
There is a benefit to that. We understand that if somebody was maybe a victim of sexual assault and their aggressor was a male, they might feel less comfortable working with a male clinician than a female clinician. And if they say that, we'll say, of course, we'll connect you with a female clinician. But we don't actually have the supply to be able to do that for male clinicians, even if patients are asking for it. So I kind of agree with Patrick here.
Closeted.
I agree with Patrick that I don't actually have to market it and say, hey, we need to do man therapy for men that's masculine and male. But I see the demand where men are going, we want therapists, but we want somebody who is maybe a little bit more active, maybe a little bit more firm. We want someone who's going to confront us. We don't want to talk about our feelings. We want to confront or have, friction of some kind. People say, I want someone who will challenge me. I want someone who's tough. Sometimes some say, I don't even want a nice therapist. So I think it's a supply and demand issue. There's more demand than there is supply. We don't have to tell them, hey, you should get therapy and you should maybe find a male therapist. They're looking for it. We're not available. There aren't enough of us in graduate school or practicing.
Yeah, I want to piggyback on that because my gateway to enter education, my first job in my agency was as a Head Start behavioral interventionist, training school staff on conscious discipline intervention. And I was partially hired because I am male, and there's nobody who's male working in Head Start. And it was the how would I say that, the drought of male healthy relationship was evident as soon as I walked in any Head Start classroom, because I instantly became the jungle gym of the classroom every time, without fail. And those kids didn't respond to anybody else in our staff that way. I was the only male staff member in that role.
Same. We did work with Head Start for a number of years, and it was the same.
Yeah, and so like they're starving for that. They really, really need, really, really want that. And I'll give you another. Here's a practical kind of intervention example that's connected to the current conversation we're having. And I don't know. I think y'all will agree with the intent of this. I feel like that a couple of you guys have expressed opinions kind of against this type of intervention, or suspicious at least of this type of intervention. But y'all know, like, kind of somatic awareness interventions. Have read about that, have heard about that. That's where you pay attention to your inner felt emotional experience, closely following some kind of stress stimuli, and then you do something physical to try to dispel it. Well, I have created materials for the school counselors that I support that provided them a word bank of somatic awareness vocabulary. And I encourage them to use it with male students, especially, to try it with male students, especially, that they're having a hard time gaining traction with in dispelling those short-term episodes of distress that I talked about earlier, because men use words less. Men talk less ugh ugh, and probably don't have as much emotional vocabulary. And from the Gottmans
Not
and
this
other
panel,
research
by
on
the
that,
way.
yes, right,
Yeah.
yeah. And so but when you're working with anybody, and just by virtue of males processing verbally at a lower intensity and frequency, other interventions may be helpful to them, or because of a lack of emotional vocabulary, other interventions may be helpful to them. And so I taught school counselors to use a somatic vocabulary and a tense release exercise along with that, especially with male students, and to talk with those male students in kind of masculine ways, like, hey, your emotions are kind of like fuel for your body that gets you to do stuff. And you can have good fuel and you can have bad fuel, and sometimes we've got to purify the fuel a little bit and clean up the system a little bit. And so we're just exercising a little bit of control physically, and part of that for me is all, I think the extra layer that makes it really effective is to highlight for them, okay, how profound was the effect of using that technique on this distress short term. So I have them scale it, like, okay, 1 to 10 scale, how intense was it before we did that activity versus after? And almost always there's opportunity for celebration, to say, oh my gosh, you got your this feeling, this tightness in your chest to go from a 9 to a 2 on the scale. How powerful is it? And then I always tell them, did I do that, or did you do that? I didn't do that. There's incredible power in attuning people to their ability to, even in the short term, regulate their own emotions. And I'm not telling them to change any belief about their ability to alter their emotions, but it's a learning experience to
Yeah.
highlight for them, I am capable of exercising control over my emotions, and I've quantified it.
You're increasing metacognition, which is one of those universal
Absolutely.
variables across all therapies. So, like, I want to get back to Ryan's question real quick, because I think what you're saying is absolutely correct, Jonathan, as well. Like, everything, you're all right. It's just the problem is not men in therapy. The problem is bigger than men in therapy. This is probably the one time I'm going to catastrophize on this podcast, which is there's a crisis of a lack of good men in Western society right now. Like, I think that the problem is not there's not enough men in therapy. Yeah, there should be more supply, blah, blah, blah. That's fine logistically. But I don't think that's the real problem. I think the real problem is we have shitty male role models for the last 4 decades in this fucking country, if not longer than 4 decades. You got boomers who are just lazy and greedy and selfish and stupid and angry at their silent generation parents. And like, I don't think the problem is us necessarily. It certainly would help if there were better male therapists and there were more of them for sure. But I think if we had better families, call me a right wing nut job, but I think if we had like better families in this country with better dads, we wouldn't be that necessary, and it wouldn't matter how much of a gender split there would be in this profession. That's my crazy right wing take.
Hey,
You're starting to sound like Adam Coleman.
I grew up with 80s action movies. I like to think that I had some terrific masculine role models.
Did you?
Yeah,
Yeah, Tango and Cash.
maybe this is the realm we need to put our thumb on the scales in Hollywood and start creating more archetypally pro social masculine heroes. Bring more of them onto the silver screen. Oh gosh,
Certainly.
I grew up watching the sitcoms in the 90s. Look at the gender relationships in sitcoms in the 90s. Homer Simpson, American Dad, Everybody Loves Raymond. Like
Yes.
those were the male archetypes.
Literally all of them.
The
Step
man
by
is the
step.
bumbling idiot who messes everything
Family
up.
Matters. Fresh Prince of Bel-Air. The woman was the mom was always in charge. No nonsense.
Hey, I liked
driving
Uncle
decision
Phil.
making.
But
Yeah.
I
Uncle
think
Phil's
if you go back a further generation, when you got like the Mr. Seaver, there was a life lesson at the end of it. Maybe the kid was, up to some no good, but the dad's going to get down and, give like a, hey, at the end of the day, we should be nice to people, or, hey, this is why you don't run with scissors. But, he would sit down and he would, impart kind of like a father-son wisdom thing. Maybe
Yeah.
we should bring some of those back to just coach. This is what it looks like. This is what it can look like.
Yeah, we
Yep.
need about 50 Fred Rogers is what we need.
Yes. Or I was thinking what Ed just made me think of was the Andy Griffith show,
Hmm.
and I got
Mm.
this picture of Andy Griffith, like, clearly, Sheriff Andy clearly sees the underlying issue like a good therapist would,
Hmm.
and is not answering the question for Opie or Barney, but he's asking them questions, or he's pointing out things that are happening around them, and he's
Hmm.
smiling with wisdom on the on the screen, and the audience is in on the joke that, hey, there's a path of wisdom for this person to follow, and I know it because the sheriff just let me in on it.
Well,
That's
If we
powerful.
could,
the
if we
thing
could,
is that. Oh no, please go ahead.
if we could like trace an arc, we've got like Leave It to Beaver, Ward Cleaver, like you're saying, like has this kind of very not excessive masculinity, but very healthy masculinity. Here's this life lesson kind of thing. And then you get kind of in the 80s and you've got like Sylvester Stallone and Arnold Schwarzenegger, like they're all on steroids, like ultra hyper
Jack
masculine.
Tripper. Oh, no.
And then like it's by the 2000s, you've got this very like emasculated, like bumbling idiot of a male role model. Like that's kind of the arc of the trajectory of like what male role models have been. Y'all see that?
Even androgynous skinny male leads. Well, the difference is World War II. At World War II, the entire country, like like we went overseas, and it wasn't like some 9-month deployment. Some of them were gone for 2 to 4 years before they set foot back in the country again. They wanted to protect their children from the horrors of the world. So they created an entire generation of television broadcast media that was peaceful, idyllic, everyone got along, and it was about these positive lessons. But try growing up with that programming. Try being the children who actually grew up watching Leave It to Beaver and the Andy Griffith Show. They hated it. They wanted grit. They wanted danger. So then, we got this kind of renaissance in cinema in the 70s, where it was really about, grit, coming to age, pain, all of these dark transformations. And I think it continued to spiral. People wanted to fight against the idyllic. People wanted to fight against the ideal and the perfect and the calm and the sweet.
Pursuer distancer.
Right. Bingo.
Yeah,
Just gonna
that's
throw that in there.
brilliant. That's brilliant.
So
Yeah.
we got a
And-
question in. Oh, go ahead.
Oh, I was just gonna piggyback on Ed's comment right there, which was, how did I just word it in my head? That it didn't resonate with some of the realities of life, which is that life is painful, and there's not always an Andy sitting in the room who knows the answer, and is helpfully guiding me to the path of wisdom there. And so that kind of reaction is natural. It's a natural phenomenon. It makes sense.
Yeah, but we shouldn't have gotten rid of him entirely. Like that,
I agree.
there is a role that wisdom figure, like the old wise man, archetypally, is a very important role. Like I've seen it. I've experienced pain. I don't want you to experience the pain I did. Try this next time.
I really want to get to Spencer's question, but to maybe create a topic for next time, or maybe a little later. We're getting a little long right now, but there is a deep underlying psychodynamic push that I think is collective across culture that created that. And you can't put blame on any one entity or system. It's as if society's unconscious drifted into complacency with the art and the film and even the music that occurred. And I mean, look at today's music. It's terrible.
Heavily
Terrible.
focus grouped rock and roll.
Yeah.
It's
But it's
Yeah,
really
man.
actually terrible this time, y'all. It's not. We're not
It
just
really
old
is.
You're
white
not just a bunch
guys
of boomers.
complaining about that Gen Alphas. Okay.
Look, 17 years of DJing, I can tell you legitimately, today's music of the last 10 to 12 years is awful across the board with very few exceptions. So
Yeah,
I would
let's-
love to explore that deeper at another time, because I love the
Okay.
psychodynamic stuff.
Let's
Can I throw
get
the
to
question in too? How long are we going? Because I don't.
how long are
I
y'all
was
here
prepared for 2 hours.
I have about
Yeah,
15
whatever
more
you want.
minutes before I have
Okay.
to duck out.
Okay.
But you guys
Let-
can
Ed
keep
has to-
going
Let's
even though
cap
I
it.
step away.
Yeah.
Okay.
All right, let's get to
Cool.
Spencer's question real quick. What do you think of the role of meaningful career development plays on mental health, both in terms of like the perception and realities of the job market?
Well, I personally think that this is something that is inadequate or was inadequate in my own mental health training, especially men, since we're kind of focusing this on the male experience. Men are ambitious, especially, post 30. If we look at Erickson psychosocial stages, once we kind of get through the isolation relationship stage, we want to generate, we want to do, and that can have, especially for men, like we can feel inadequate, we can feel powerless, we can feel like we're about ready to be fired or abandoned, even by our relationships, if we're not making enough, or if we're not, or if our job title isn't fancy enough that people that our wives would leave us, or something of that nature. Like this is a really big source of pressure for men. And the good news is that we do have a lot of research into vocational psychology. We know how to, help people along, guide them along. But I think we are inadequately addressing the emotional and identity component of the ambition for being underemployed or sometimes unemployed and, just desperate for any work. I don't know if I made any sense with that, but
I want to give a real life example. I have an excellent mentor. I just recently started meeting with him again over the summer. Shout out to Dr. Tom Milholland. He was my General Systems Theory and Cybernetics professor. He chaired the program at one point. He's a former AAMFT president, and I believe sat on some committees there. He also has license number 1 in for LMFTs in the state of Texas because he spearheaded the effort to create the license. For me, my connection to him as a teacher is a very powerful motivator to fight for the identity of my profession and how I portray that to the public. So that ties back to some of our conversation previously. But him as such a really good, strong male role model of how to think systemically in the true sense of that, not the activist sense of that, is something I constantly return to, and it motivates me to continue learning and continue connecting my previous learning to new research and to new concepts. And you psychodynamic guys, I got zero psychodynamic anything because it was a pure AAMFT co-AMSA program. It was general systems theory from Ludwig von Bertalanffy and Bateson forward. But I have been very thankful to be able to connect some of these psychodynamic concepts to that tree through interaction with people like Jake and Ed, especially online, and connect, to some of the even further back and deeper taproots of what we do. And it's amazing. There's so much incredibly proud tradition and brilliance and wisdom that's wrapped up in it. And I get passionate about it, talking about it. It's amazing.
For me, this is, yeah, I agree with all that. We had one career counseling class. It was terrible. And we didn't talk about any of the vocational development stuff that you referenced. I had no idea there was a large body of literature. That's embarrassing to say, but it just wasn't covered. And the punchline to the joke was like, yeah, when are we ever going to career counsel someone, right? That's for college people, right, or whatever. But the simple fact is, a large percentage of folks who walk through our doors are just not happy with what their station is in life. And when we spend so much time at the office, if we're on the wrong path, if we're not on our calling, we're going to be miserable in multiple domains of life. So I tend to, I playfully say, what do you want to be when you grow up, right? Even to somebody who's been 20, 25 years in their profession, this, talk about vulnerability, right? If you have good enough rapport with somebody, you could say that playfully and seriously and deliver it well, they will pause, and you can almost feel the air get sucked out of the room as they start to go introspective and sometimes tear up and go, I don't even know. It's like, I came into this for whatever reason. I needed money. It was convenient. I chased the fancy thing. My parents pressured me, whatever it is. It was not of their choosing, right? So I happen to think that undergrad, tracing back to high school, has the whole thing inverted. We ask kids to pick a major. We don't ask them what they want to be when they grow up. We don't ask them what career they can envision themselves doing.
What their strengths are and how you can even monetize that.
Right. What gets you up in the morning? What are you passionate about? I don't care if you're 16 or 17. You got an answer, right? I want to be a professional ball player. Cool. I know the statistical odds of that not happening, but let's get you close to whatever that is. What is it? I like the activity. I like the change. I like the excitement. I like the spring. Whatever it is. Okay. Then let's pick the path that will get you there. And it may not always be a 4-year degree, but if it is a 4-year degree, let's pick the proper one, right? And I didn't discover this until grad school when I found myself fully engaged in all my courses. I happen to have 2 grad degrees. The first is higher ed administration because I was going to be a college student development person. And I got in there and I was like, man, I can see the application to all this stuff now because I know where I'm going with it. So when we get into the therapy office and we have somebody who's really struggling with whatever they're struggling with, anxiety, drinking too much, mood disruption, I just ask them, who are you? Who are you meant to be? Like, what is this soul sitting in? I don't care about your outward behavioral presentation so much. I care about who are you on the inside and what did you come out of the womb designed by God to be, to walk the earth? And are you doing it? Because Jung talks about this too, and not so many words, but if you got a path and you're off the path, you're going to have psychic distress. So I just start there and go, what do you want to be? If we magic wanded this thing, you woke up tomorrow and you got out of bed and you put your 2 feet on the floor and you were excited, what would you be excited for? And then we start tacking a little bit toward that and say, all right, what are your priorities? Is it money? Because you could let go of money real quick and realign yourself, and all of a sudden you're trading money for happiness. And peace of mind is worth something too. It may not be as big of a paycheck, but man, it's totally worth it if you're present for your children, right? So for me, I just go straight to the identity thing. Who are you? What do you want to be? What's your contribution to the world? And what fires you up? What gets you up in the morning? And then start to reroute from there. I think we lost that somewhere along the way. And again, it's a psychodynamic concept of asking who are you at your core, not just what distresses you today. Can we get you to put down the bottle? Yeah, sure, that's a good idea. No employer is going to want you drunk. But what's the why to the what? The why to the what is often a deep issue of just calling, right?
Well, there's the big question though is when you ask that, very often the patients will say, "I don't know," and this is very often we see
They
it
stop
and they
dreaming.
don't. Like you'll ask them what they do and they'll go, "Oh, I'm in law school and I'm studying for the bar exam," and then you say, "Oh, what'd you do this weekend?" "Oh man, I 3D printed this gear thing that I'm putting together because I'm building this like robotic arm that grabs stuff," and you tell them you lit up, like you completely lit up when you talked about that versus when you
Yep.
talked about that. Let's follow that. Let's see where that's coming from. Maybe you should follow where that vitality is instead of what's maybe draining you or
Yeah.
causing you distress.
And that unfortunately is so terrifying to pursue because it requires vulnerability and it requires letting go of what they think they know is best for them and opening themselves up to this high risk possibility of everything.
Hmm.
It's like, man, it's an ego exercise. You got to dissolve your ego, the familiar part of you that you know really, really well, but it's just not working anymore. And it's terrifying if they don't know how to navigate that emotionally. It's gonna be really hard to go that direction, and it's sad because, like I said, I dropped in there. Sorry, I interrupted, but I said they stopped dreaming, or maybe they were never taught to dream to begin with, and that's really sad too.
Mm.
I see this a lot with the ADHD population because they have been told to maybe get some rote, repetitive, low stimulating job just because they need to work, as opposed to following what stimulates them. And
And
sometimes,
doing
again,
many things.
yeah, you point out to them like this makes you hyperactive, like that scratches that lobe in your brain that makes you want to hyper focus. That's
Yeah.
a talent. Lean into that. What are some maybe job paths or career paths that tickle that? And a lot of people said, I didn't know there were job paths. I didn't know there were things that could
Mm.
tickle that. Like emergency rooms. Tons of people with ADHD thrive in emergency rooms because they're calm and they're calm in a crisis.
You, I'm curious if Patrick. Patrick's been quiet. I'm just going to co-host for a second. Patrick, what do you think?
So I hate to be the there's research on this topic guy.
But we know that's
So
you, so go ahead.
That is you. It's literally you. So go ahead and fill that role.
it's literally allow me. So as a consultant, what I do for a living is I supervise and mentor, hire, and fire people. And so I do that, ethically speaking, with the best research and tests that we have. So there's like the strong interest inventory, which is great cross culturally too, and then there's the 5-factor model of personality. So when I do this for a living, I'm interested in who the person actually is, kind of like you're saying, Jake. But I don't care what they say, in all honesty, because people are self-deluded, they have defenses, they have denial, they have trauma, they have all these reasons why they're going to tell you a story, and I don't
We
really
don't know
care.
ourselves very well.
Right, precisely. So I don't really care what the person's story is about themselves. I really want to know what their personality is first and foremost. And so if you're telling me someone is extremely conscientious by their temperament, I don't care if you want to be a race car driver. You should not be a race car driver. I don't care what your dreams are. I care how you're built first and foremost, because there is this real thing called personality, and it's going to be a better predictor of your success career-wise than whatever your fucking dream is. Also, there's research that shows very clearly there are essentially two types of people. There are people that have jobs, and there are people that have careers. If you're more intellectually limited, to be nice about it, then you're going to have a job, and you're going to find meaning and mental health and purpose from non-job related activities. However, if you score very high on trait openness or very high on trait conscientiousness, or your IQ is above probably 115, 120, then you're probably not just going to have a job. You're probably going to have a career. And so your mental health is going to be more tied into what you do for a living compared to if you're more intellectually limited, or if your personality is more around the 50th, 60th, 40th percentile of any particular trait. You're going to be a run-of-the-mill person, which means that you're not necessarily going to need a lot of stimulation or meaning or awe or whatever in your job in order to have mental health in your life. So that would be my approach to it.
Yeah. And I'm going to piggyback on that because Patrick went right where I wanted to go, which is that's the Mike Rowe school of thought on occupation and work. And I love Mike Rowe. I use Mike Rowe's material with every teenager that ever came through my private practice office. Because your life add to Patrick's thought there, your life circumstances and your awareness of pathways or lack thereof may dictate you ending up with fewer possibilities and in a job, to use Patrick's term, that is not automatically granting fulfillment, emotional fulfillment, sense of purpose, right? And so this ties to a definition of masculinity. And I'm actually going to tie Matt Walsh back into this conversation here too. You ready? So
if that guy would just pick up the phone and answer our calls.
I know.
We could fix every opinion of his just right now.
But he the way I'm making some assumptions, and some of them may be unfair, but I'll say that up front. But it appears to me that he has a singular view, and very rigid view of a path to masculinity, that has very little variability. It's one train route, and it's a monorail. That is not masculinity, in my opinion.
But it gets followers. That he's a sensationalist. He knows exactly what he's doing. He probably has more nuanced and broad beliefs, but he can't say them because he'll lose half his audience.
He'll lose audience. He'll lose followers.
He doesn't care about people. Let's be clear about this.
Yeah. No. So what masculine? I'm going to define masculinity here, or helping someone to grow their sense of masculinity is to put that individual man in charge of defining for himself what is and is not masculine. Period. The end. I can like Monet. I love Monet. I love impressionistic art. That's not a like archetypally masculine thing to appreciate. I can enjoy going to musicals, and I do. I took my wife to Hamilton year before last. Loved it. Phenomenal. I have shot an AR-15 at 938 yards in a Tough Mudder running
and hit the target.
Yep. And hit the target. I have deadlifted. Yes. Did I hit it? I didn't hit it every time. No, absolutely not. I'm not going to even pretend. I had spotter help too. But I can deadlift 435 pounds. Those are archetypally masculine things. But nobody gets to define for me what is masculine except for me. And instilling that in clients and in male professionals is potentially really, really powerful, because it allows you to integrate those elements and layers of personality that Patrick was referring to in a way that's not polarized, in a way that's there's no schism or division. And that's good self of the therapist work. For one, it informs transference and countertransference discussion, because you have to integrate yourself into the process. And so we shouldn't shun masculinity. That's hobbling the male side of therapy, period. And so, so to tie Matt Walsh back into that, and to tie some of the other things we've discussed back into that, as we're bringing up, helping bring up in whatever capacity other professionals, I think helping them to define that for themselves, and helping male clients who are having this job versus occupation question rattling around in their brain. The answer to your career here's an example for real in my office. If I have a guy who's become a stay-at-home dad because he's married to a high-paying medical professional, I have to help him identify what is masculine and fulfilling about your occupation of being a stay-at-home dad, and you have the right and the responsibility as a man to define that for yourself. In doing so, it is masculine for you to perform that.
Great.
Sorry, I didn't
Closing
appreciate
thoughts.
Our podcast.
Anybody have any closing thoughts before we cut it?
I do actually. I say this frequently. I actually have a video somewhere about it, but in English we have one version of the infinitive verb to be, and it sounds very permanent. In other languages they have two versions. One's permanent, one's temporary, and they're indicated as such when you speak, so that the listening audience knows what you're talking about, whether what you're referring to is fleeting or has some semblance of permanence. So when we say I am in English, what follows sounds like a characterological trait. So I say I am an accountant, right? Now I've interwoven accountancy and my practice of doing that job or career with who I am at my core. And if I've conflated those concepts, when I entertain the idea of leaving my accountancy practice, I am ripping apart my core sense of capital S, self. So what I invite people to do is be very, very careful about their I ams and choose them wisely. So Bob the accountant, who is Bob the accountant across the community and to everyone, I doubt that he's going to want on his tombstone, Bob was a great accountant, and that's it, right? Bob's also a dad. He turned out to be a grandfather. He was a ball player when he was younger. He's a home brewer, on and on and on. Loving member of his community, all the things. So when we talk about careers and existential crises, the very existence of a person is so infused with the career identity, especially in the West, especially in America. I think that it becomes really, really challenging to help them understand that they can be more than just that thing, which also alarms me when we walk around with these identity things with, gender identity and so forth, and racial identity and whatnot. It's like, are you deeper than that? Yes, you are, is the answer. You can be many things depending on the time of day or the circumstance. So I would invite people to hold very loosely to the I ams and know that at your core, you're much deeper than whatever it is you've been doing, and try to focus a little bit more on what you want to be to the rest of the world. And I think that'll alleviate a lot of our overly rigid psychiatric distress that we feel when confronted with the opportunity to change, especially when it comes to retirement. It's like, well, I don't know, quote unquote, who I am without my career. It can be very threatening, and we have all sorts of weird ailments that come along with that. So that's my closing thought: is watch your I ams as they relate to your identity, including masculinity, your job, your occupation, your hobbies, your interests,
Your diagnosis.
your diagnosis, right? Yeah, we don't walk around
Reading my
saying I am headache, or I am flu, or I am broken arm, right? Because they're temporary. So that's my closing thought.
I really just want to piggyback on that, because linguistically I'm tickled by this. In other languages, like Japanese, I believe instead of I am depressed, they would say I have depression. And I think some of the Germanic languages and maybe some Slavic languages, it's like depression is upon me, or depression is present, versus I am depressed. And it's just a weird thing in the English language. But no, my closing thoughts are just go to therapy with a goal. Like, just go with the goal. Just try it, man. It's pretty rad. But go with the goal. Actually have but actually have something to work towards.
Glasseries would say, "I am choosing depression. I'm choosing to depress.
Yes. I'm choosing all of my experiences. Sure, that's
I'm
how it
choosing
works.
to anxietize. I am anxietizing."
So we got in a little. I'll just throw one more little thought on there. That Jake, when you were talking through your thoughts there, you used the accountant. I flashed back to our discussion about military service members. I think it was yesterday on Twitter, and the like job transferability of some of those roles and how hard that. So that's just my plug to get on Ryan's podcast one more time, because I think Ed's experience on that could be really powerful. I worked with a lot of military families here in Abilene and took a lot of CEUs on that. And I would love to talk about that more, and that career identity connection there. It's incredible.
You want to get on one more besides this one, besides the one you were already on? So
Yes,
that'd be 3?
yeah,
Okay.
yeah. I'm trying to
Wait,
set.
this is your 5th one, isn't it?
I'm trying to set a record for the most
heck,
appearances on Reality Therapy podcast.
I think
okay?
Katie Kernodle has it now.
Katie's winning currently. She's winning currently, but I'm trying to edge her out. So Katie, the gauntlet is laid.
I'd like to
Coming for
remind
ya.
everybody that in the 2018 APA guideline for treating men and boys, we are discouraged from
don't.
reinforcing competitiveness. Competitiveness is a toxic, traditional masculine trait.
Well, does it count if Katie is a woman and she's competing? Does that just
Well,
nullify it
sounds like
all?
patriarchy.
You're
to me.
supposed to encourage
Crap.
it in women. In the APA guidelines for treating girls and women, we should be encouraging competitiveness, because how
can't-
else are they going to succeed?
I have to give up my competition now because I'm oppressing Katie if I oust her as the top seeded appearer on this podcast.
Yeah, man,
Stop being
check your
such an
privilege.
oppressor, you white patriarchal devil.
I'm such a patriarchist, man.
Dr. Lockwood, what you got?
So there's just so many things to say. I think I'm not going to respond to anything that I've just heard, other than saying I put up a YouTube video years ago talking about how the American Psychological Association is full of shit. That being said, if you want to see that, go see it. I am not in competition. Ryan, it's lovely talking to you as always. And if you would like me to come back, I'm grateful to be here. However, I'm not, I'm
You're
always
not
available.
first,
if you
you're
want.
last, Patrick.
That's right. And I'm okay with that.
You're such a
He's
dare
humble
man.
The joy of Buddhism, right, is that you don't have to attach to any particular outcome. It just kind of is. And if I'm here, I'm here. And if I'm not, I'm not. And it's cool. And so, like, I've spent a long time trying to develop this mindset, and it works.
And that's why I'm going to reach nirvana before you, man. I'm going to escape samsara so much faster, you have no idea.
I'm looking forward to it, Ed. I really am. And because you know what? I can learn something from you. And it's a privilege to learn from other successful, talented, accomplished
from
people.
behind while eating my dust.
You're
Exactly.
headed to Nirvana at a snail's pace. We're gonna smoke you.
Yeah, that's okay. It is what it is. I don't judge it. I get to experience it. And I have gratitude for the experience. I have gratitude for this podcast. I just want to, my actual serious closing thought is thanks for letting me be here. And again, I want to double down on what I said earlier about encouragement. I think men in particular need a lot more encouragement nowadays. Everyone does, but I think like if you're a dude and you have the opportunity as a mentor, as a professional, as a colleague, as a friend, whatever, to encourage someone else, please do it, because I think that the world would benefit from more encouragement.
I like
Amen.
that.
Amen.
I also
can I
encourage
echo?
you to
It's-
encourage.
Yes, absolutely. I just want to echo, man, it's an honor and a privilege to be as close to face as we can get right now with people I interact with online all the time, and have more real life with you guys. Amazing.
Fun.
Awesome. Wonderful
Ditto.
panel, gentlemen. Loved it. And maybe we can do this again in a month or so.
Yeah, you bet.
Sure.
Thanks for having me.